good afternoon. I'm acupuncturist, and as acupuncturist, I always wanted to more understand about Western so that I can find any connection between Asian medicine and Western medicine. So this is my honor to have a Western doctor with me. So anything I wanted to know and understanding about Western. So
Okay, I'm not really Western doctor because I'm part of the holistic medicine. I'm a chiropractor. But from my opinion, what is the similar from the Western medicine and acupuncture, that both of you using the substances to treat some medical problem or medical condition. The difference is that the Western medicine based mostly on the artificial chemical substances. Instead, the Eastern medicine or oriental medicine, you're mostly using the natural substances, what is, in my opinion, better for the human than the something artificial. The other stuff, in my opinion, what is the difference with the Western medicine right now? They treating condition and treating the symptoms. In my opinion, that the acupuncturist and all the representative of the holistic medicine, with trying to solve the problem, what is causing the symptoms or condition. Definitely not all the stuff it can be done the same way, like, or better way than the Western medicine. But in my opinion, the Eastern medicine, oriental, it's mostly oriented to prevent something,
I see.
the condition, either they treat them. So mostly for the prophylaxis. What is sounds good for me as a chiropractor. Because the chiropractor also, we just trying to find the reason why the certain condition and the pain the people experience, and we're very limited in our practice. We're just solving them. If there is pain causing mechanical problem, this we actually can solve the problem in the office. Otherwise, if the source of the pain is maybe some internal problem or systemic problem, so actually it's not our scope of practice, and we have to refer for somebody. And this, in this situation, more important stuff is diagnostics. So this what is very important, because sometimes right now there is a new way how to Western medicine growing. It's a computer diagnosis. So they actually make some studies and the machine will decide what kind of disease you have. For me, it's, I don't know, probably it's very complicated. I don't know if the computer can adjust and or put the needles, because sometimes we just depend on the doctor's ability to feel what the patient feeling. So it's called empathy. And I don't think the machine can do it actually. So
that's
who
right.
will survive in this technological new technological life?
That's a really good point.
So this is what I'm thinking about. So if you have any question, just ask me. I will
so
answer.
like sometimes like most of Western doctors based on science, like their mindset is like a fix it, and then usually what they think, what they believe is like a to see is to believe. Yeah. And but for me, so that kind of approach is a little like a limited. Yeah. So you as a Western doctor, I'm really surprising to hear you little more understanding about like what is like the pros and cons about Western, and also pros and cons about Asian medicine. Yeah. So and then I like to hear your point is one of the benefit about Asian medicine is more preventive. Yeah, and the holistic, and then natural. Yeah. So and then also the Western part, like you said, is a more focusing more like some systemically. Yeah, but not for the functions. Yeah.
And the other stuff, what is actually what is great in the Western medicine, it's like surgery or pretty like emergency.
Yes.
A very intensive care, so just to saving the life.
Yeah, that's right.
So for this reason, I thought there is mostly like symptomatic treatment. And they actually try to do prevention, and the same using the artificial substances, what is not normal for the human body or some alive people. Like I mean the vaccination, some chemical vitamins, because the thousand and thousand years, the people, all the history of the humanity development, they were using the natural resources to treat the health problem or to have a meal or something like this. So and another stuff what I don't like in the Western medicine, it's a dosage, how they use. So for example, like Eastern or Asian medicine mostly use the low dose, because everything is poisoning. Even our meal, what we're eating every day, it's all about the dosage. This is, it's not my words, it's what told the Avicenna, the ancient doctor. So he told us everything is about the dosage, the treatment. So not all the time what is excessive is good. Sometimes it can make worse. But the people right now thinking the more you have, better it will be. For this reason, we're developing right now a lot of the autoimmune disease, systemic disease, and all these diseases is getting too young. So even the young people starting to be sick of this problem.
I see. Yeah. Good.
So the other what my knowledge is about acupuncture and my personal experience in it, I think it's great stuff because it's communicated with the internal, let's say internal computer of the human body in the natural stuff. And it can cut or change the direction the certain processes, what is actually good, and give the signal to the body that something going wrong. So in my opinion, not the pain is the main problem. Pain is just signal that something wrong, and the doctor have to find the reason why.
Exactly, that's right.
Yeah. So.
Yeah. So little bit surprising to hear that, like, what your point is. I totally agree. That's exactly what I thinking. And then once again, each individual has a different opinion. So this is not for like the Western or Asian medicine is better than each other. That's not the purpose. Just I wanted to know just each one's opinions and what they think about the Western medicine and Asian medicine. So if you have any like opinions and questions, and I'm happy to hear. So I appreciate the doctor a little bit share with me her opinions. Yeah, and then I hope so next time we can continue talk about anything about either Western medicine or Asian medicines. So more important thing is it's not a Western medicine or it's not a Asian medicine. The important thing is it help for the patient. So that's the main purpose, I think. Okay, thank you for everyone.